Good morning, and welcome to the 10th anniversary of Moms Orange County's Healthy Beginnings and Bright Futures event. My name is Sadie Sachs, and I'm the president of the board of directors for Moms. Things look a little bit different here this year, as I'm sure you're not surprised. Just like all of you, Moms is adapting to the changes in our community and in our nation. And despite this, we are happy to announce that we're meeting new professional milestones. Our incredible frontline staff have pivoted to provide our services remotely to families who need our services the most. Babies are showing up, working hard, meeting new milestones right along with us, while their moms and dads continue to lead the charge and encourage them. Please stay tuned and follow along with us today on Facebook and Instagram as we bring you Healthy Beginnings, Bright Futures, Home Edition. Thanks for joining us.
Hello everybody, my name is Anusha Wijayakuma and I am a board member of Moms Orange County, and I am so excited to be here today with Dr. David LeGroux, who is also a fellow board member and Executive Medical Director for Women's and Children's Services at Providence St. Joseph Health. And today we're going to be talking about a number of exciting topics, but I'd like to first begin by giving Dr. LeGroux an opportunity to introduce himself before we get into our questions that we have planned for you all today.
Yeah, thanks, Anisha. Yeah, my background, just so people know, is in high-risk obstetrics, is what I did for my clinical living, as well as got into clinical informatics. Which is the study of using computers in medicine. So I think today's topic will be very timely.
Thank you, Dr. LeGroux. And we're here today to talk to you all about how the healthcare landscape has changed amidst the current health crisis with COVID-19. And I know this is very much a trending topical issue right now in so many different areas. But we're honored to have Dr. LeGroux here to talk to us today about prenatal and postpartum health and care. So I'd love to begin, Dr. LeGroux, with a question for you. Around telemedicine, I know that we've been moving towards telehealth during this pandemic, and we'd love to get your perspective on the telehealth, telemedicine horizons, and what you've been doing in your own administration and hospital, but also your personal opinions as a physician about this new landscape that we're living under currently.
Sure, happy to answer that. I think it's interesting because the whole field of telemedicine has been around. We've had the capabilities to do telemedicine for many years, and there's been no event, at least in my career, that has put more pressure on us to get going with it in a big fashion than the current COVID outbreak, because as we do social distancing, of course, this has become an invaluable tool to still allow providers and patients to interact. So it's quite from telemedicine. It's quite a historic time period.
And would you say that you feel that now a lot of patients have become more familiar with telehealth and telemedicine, whereas perhaps before they may not have been so inclined to be open to telehealth? Do you think that that's changed from a patient care perspective for both physician and patient during this pandemic?
Yeah, I think there's three major sort of buckets you could put telemedicine and how we're serving patients with it. The first is the one I think most people would understand, and that is purely the interaction between I as a physician speaking to you as a patient, or trying to do the things that we would do in the typical office setting from a conversational standpoint, and taking a history and asking about symptoms, etc. So that one's pretty straightforward. We actually, even some Some setups have things like stethoscopes and scopes to look in ears and things of that nature that people can have done. But for the most part, it really is about having a video conversation with your provider. The second sort of way we use it is what I'll call tele-educational. And what I mean by that, so much of the care that we give is educational. In fact, it took me a long time during my career to realize that to a certain extent, teaching was a huge part of what I did with patients, right? In other words, explaining things, going over things. So, for example, we may do counseling about gestational diabetes or genetic counseling or breastfeeding support or even have sort of little checkups like blood pressure checkups where the patient checks their own blood pressure and then sends us the results, or we follow up by looking at a picture of a wound that she may have so that we can check and make sure it's okay. All of those things you can do very nicely over a video conference link, and so it works out very nicely. And then lastly, I think where particularly it's been important during the COVID infection is sort of virtual support. In other words, having people who we had to keep out of the hospital setting or the clinic setting because of infection control measures, but still are important to be there. And I think no discipline in medicine was this more important for us to do. So, for example, we've gotten special iPads to put in the labor and delivery area, or so-called baby cam, where moms can watch their baby in the NICU. Those types of things have been very nice in helping them. It's interesting. We used them before. We would have dads who were deployed overseas in the military watch a delivery or be part of it, but it's really become an important tool for us at this point.
That's really interesting, especially in terms of telemedicine, about the capability that patients have to actually check their own blood pressure. And that, you know, with wound care, you're able to actually, physicians analyze that, get back to the patient. And I don't think necessarily that many people perhaps are aware of those capabilities via telehealth and telemedicine. And I'm sure that moving forward, we'll probably see even more progression.
Absolutely. It's just like the Apple Watch. Now, some of that stuff, to be honest with you, in my opinion, is just sort of fun. But I think, to your point, there's no reason the way it's automated, people can't take their own blood pressure, right? Yep. And so we can do it more often. We can do it in a setting where we're not scaring the heck out of people. And so we get a real reading. What's your blood pressure when you're doing your normal activities?
Right. Well, that's really interesting. It certainly enlightened me about some questions that I had. I know that we're doing telehealth and telemedicine at Hoag, but obviously for different patient care specialties, it's different. So with OB/GYN, the routine tests that women have to go through, it is the testing of urine, the blood pressure, etc. So that's really kind of interesting to hear from you. I would love to now kind of talk about your perspective with what does hospital access and medical care look like for pregnant women and babies right now?
Well, I mentioned it earlier that unfortunately one of the things we had to do is limit the normal family support that we think is such an important part about what we do. So currently, we are limiting just one support person with the mom in labor and delivery, and one support person who can be in the mother-baby unit in the postpartum. So to get the interaction, to get the folks in there that can be an important part of it, such as the rest of the family or a doula or things of that nature, that's where we're beginning to use iPads and other devices to help us link and pull those folks in.
Right. Well, that's really interesting, certainly for our audience watching, that maybe patients, maybe clients, and our donors as well, just to kind of find out what the landscape is really looking like. And, to me, with the clients that we're serving, how do you feel that underserved or high-risk populations are being affected during this period? And are they able to access healthcare?
Well, there's no question that one of the unfortunate things that the COVID epidemic has done has made it such that it's really unmasked, if you will, a lot of the problems that we had before going in. It's just they weren't as acute. So, for example, we know that here in California, unfortunately, the death rates we have seen with the COVID infection disproportionately affect African Americans and women of color. We've known that for maternal mortality. We've known that for a number of things. It's just been accentuated by this problem. And so one of the neat things I think about some of what we're talking about virtual care, can actually, if we use it right, can actually help that. And why did I say that? Well, first of all, we know virtually every mother in California, and we've actually done surveys internally, and this has been validated with research studies. Everybody has a cell phone these days. People prioritize their cell phone to have, and so that's a device that that's readily available, that we can get access to folks. It's interesting, there actually was a research study published about 1.5 years ago out of Pennsylvania, where they did blood pressure checks, getting back to our blood pressure monitoring. And so their usual care was to bring the patients back about 1 or 2 weeks after discharge from the hospital so they could check their blood pressure. Well, unfortunately, a certain percentage of people in the meantime or whatever, their blood pressure would go up and they'd have to come back to the hospital, eventually be readmitted for medications and things of that nature. And one of the unfortunate parts of that as well, for some of the reasons we were just talking about, is African American women had a greater rate of having to come back in and get readmitted than did the white patients. And so there was this racial disparity, if you will, in the outcome of those patients. So they got a app that they put on everybody's phone. They gave everybody a blood pressure cuff and instructions, and the app would nag you at a certain time of the day, hey, Anusha, check your blood pressure. And it would actually, the app, you'd put the results in, and it would actually then process it. And if it was obviously extremely high, it would immediately notify the doctor and the different folks. And anyway, they did this over a several month period. And once they started doing this, they cut their rate of readmission for this problem by half. And more importantly to our discussion, there wasn't any difference now in African American and white patients that they had before. So essentially this tool cut through some of the racial disparity. So very interesting. And I think what it tells us is, it's like COVID in general. There's going to be changes to how we practice medicine. Let's not cut out the human touch. Let's not cut out the participation, but let's take advantage of some of these new technologies and changes that we're making to respond to COVID and actually improve our care going forward. So, we eventually will get through this, right? Vaccines will come along, we'll get better testing, all this stuff that we worry about right now will be solved. But it's going to take a while. That's the message I think everybody's putting forth, right?
Yes.
But on top of that, I think at the end of it, I think we'll actually have better care. I think it's like anything else. We'll respond and learn some lessons, and we'll be better.
Right. And I think that's an important point, because if we look at COVID, the higher rates of African American people dying, if we look at maternal health in America, the higher rates of African American women with mortality rates. So I really hope that, like you said, Dr. LeGroux, we see this as an opportunity in healthcare to have greater access to underserved communities, to ensure that we are combating some of those inequalities in place.
No, absolutely. And I think, as you know, from being on the board, a lot of the things we're doing at Moms, is helping us learn these lessons, right? And learn how to do it. I mean, one problem with all this is we as physicians and we as nurses and we as dietitians, et cetera, we weren't coached or learned how to interact on TV, if you will. That was not something, trust me, that's part of any med school curriculum.
Right.
So we're going to have to learn how to do that, right? We need to learn how do you get to know Ellen? How do you get to know Oprah? How do you get, there's that personal thing. At the end of the day, I'll bet you, because of the access, because of the way we do things, and again, I think we found some of these lessons at Moms, we can do just as good a job and in some cases incorporate and pull in people that we couldn't do before simply because we had these new tools.
Right. Well, that's so interesting, and thank you so much for your time, Dr. LeGroux. I really appreciate it, and I think these are interesting times for all of us. I mean, as we can see, I've got my son racing about here. Yeah. All of us who are mothers that are now working from home, taking care of our children full time. It's a changing landscape that adds more stress and anxiety to our lives. And so how do we all cope with these challenges, as mothers and as parents? And I think, hopefully, like you said, COVID will afford us all the opportunity as a society to come out of this focused on unity and cohesive collaboration together. So thank you so much. And
my pleasure.
Looking forward to what Mums has coming out with more of these series.
My pleasure as well. Everybody be safe out there.
Yes. Thank you so much.
Hello, my name is Luisa Santa, and I am the Chief Program Officer at Moms Orange County. For years, my passion has been to empower women, especially women of color, so they feel like they have a strong support system to thrive in our community. Here at Moms, we're all about connection. We connect our pregnant mothers to a trusted and trained home visitor in the times where she needs us most. We also connect families with health educators to walk with them through their journey to parenthood. And once baby's born, we help those families build that important connection with their little one. Now, more than ever, we realize how important connection is. The stay-at-home period has been especially challenging to the families we serve. Ongoing physical distancing has deepened the isolation already felt by so many, and the economic downturn has elevated stress around accessing basic needs. Expectant and new mothers, sleep-deprived, physically recovering from birth, and often struggling with nursing, fear for their newborn's health and their own ability to navigate these unusual times. While growing concerns emerge around mental health, child welfare, and an uptick in domestic violence. These are the stressors our families face. Yet, in the past 8 weeks, almost 1,000 pregnant women and new parents have had someone to talk with. Our amazing team has worked to shift all classes, all home visits, and breastfeeding consultations to a remote and virtual platform, and they've done it so beautifully and successfully, if I may say. Through these connections, the families who need us most have continued gaining quality health education and have been connected to much needed resources like food, diapers, financial assistance, and more. Regardless of what's going on in the world and the obstacles for all of us to physically connect, Moms continues to rise to the challenge. Moms was established to help combat a severe prenatal health crisis in our community. Yet, 30 years later, Moms is continuing to connect with families, empower women, and help shape better outcomes for new generations of babies in Orange County. I feel so incredibly honored to be part of this team.
Hello, I'm Larissa Chabin, and I've been a home visitor at Moms Orange County for 19 years. I'm here today to speak with my client, Lisa Cervantes, and she's going to share her story with us. Hi, Lisa. Thank you for taking the time to tell your story outside of our monthly visits. I'd love for you to share what led you to Moms Orange County and what you hope to find here.
Hi, Larissa. So nice to join you today. Thank you so much for inviting me to share my story on how I came to Moms Orange County. It was my last pregnancy, actually. As new parents, I wanted to do everything we could to set us up for success, set our children up for success. And in my hunt for breastfeeding classes, post-pregnancy therapy, which I knew was crucial and something that I definitely wanted to invite into our world. I grew up and I really wanted to be prepared. We had a very clinical pregnancy with my daughter, and I just wanted to take the steps in the best nurturing we could find for her. In my hunt, I found Moms Orange County. I found that they were so much more than just classes. It was a support network. And as I scoured your website in and out, I found that it provided support for myself, support for my husband, and as a family, the nuclear family, I wanted us to be as prepared as possible and knew that we would have an organization behind us. So I really found that Moms was aligned with our values, our virtues, and I knew this was the place that I wanted to be connected with for the pregnancy and post-pregnancy. My husband also participated in the Taller para Papás, which was a support network for the husbands. It was led by husbands for husbands. And he came back from that excited, supported, and I couldn't ask for a better way to start this journey. So thank you again.
Great. Yes, you've mentioned to me in our conversations your desire to change your family tree. Can you share what that means to you?
Well, we grew up in a very dysfunctional home. My parents were both incarcerated for my adolescent years, my first 7 years. And as we've learned, the first 5 years are crucial to an infant's development. And I knew I didn't want to repeat that. I knew I wanted to change my family tree. Prior to joining Moms, I would say a few years before, my sister had hosted a class on nonviolent parenting, and I actually had attended that as well. So just attending that 4-week class resonated with me, and I knew that that was important to me. And on every aspect, I wanted to change my family tree. My dad's a Vietnam veteran, so I was diagnosed with secondary post-traumatic stress disorder. So he was emotionally disconnected. And I found that in my youth, I was also emotionally disconnected. And I did not want that for my spouse, for my children, and for that legacy that goes on. We know how much touch matters, how much connecting with your children emotionally, how much it matters. So that was another aspect in our generational change that I wanted to be aware of and also change.
Yes, we met 2 years ago when you were pregnant with your little girl, Vivian, and now you're here with 4-month-old Luca. What brought you back to Moms this pregnancy?
Well, I knew I could count on you. I knew I could count on Moms. I knew that the support was going to be there. I knew that every pregnancy would be different. And so I didn't know what life was going to look like with my son. So and I was also experiencing some postpartum depression. And so, I knew that I could tell my OB, but it definitely wasn't the same. There's not the confidence, the connection, the support that I knew I would have with you. You really were the one I wanted to talk to first about that. I could have that intimate transparent conversation with. And with that, you had provided me and connected me with OC Parent Wellness program. And I've had an initial conversation with them. They did an assessment, a very thorough assessment. And that's unlike any other experience that I've had. It's the same as when we go through the milestone checklists, and we go to the pediatrician for their regular checkups, but they're never as thorough and engaged as when I'm with you. So this is definitely where I wanted to be for the second pregnancy.
Thank you, Lisa, for sharing your motherhood journey with us. I'll see you soon.
Thank you.
Hello, I'm Andrea Pronkton, Chief Development Officer for Moms Orange County, and I want to thank you for joining us today for Healthy Beginnings, Bright Futures Home Edition. Today, you are able to get a glimpse into the work of Moms Orange County and see why it's so important that we partner with new mothers and fathers in our community. You met Lisa, who is struggling with anxiety and depression. Many new mothers are facing these same issues, especially now during these very stressful times. But because of you, we've been able to make a huge difference in the lives of thousands of families in Orange County. We're counting on you now, especially during this challenging time when vulnerable families are facing even more difficulties than ever. Help us be there for those families. With your support today, we can provide these families with hope, a circle of support, and a better future for their children. Thank you for any amount you can give.